If you're over 60 and taking vitamins or supplements your doctor recommended, what I'm about to tell you could change everything. Because there are 5 common supplements that doctors prescribe routinely to patients your age that sound healthy, sound preventative, sound like they're protecting you. They sound good, but they're not. They're quietly building up in your system, creating imbalances and triggering side effects that are often mistaken for new diseases. And I know this because I'm the one who sees you in the emergency room when things go wrong. I'm Dr. Chen. I'm an emergency medicine physician. For 18 years, I've been on the front lines, treating patients who come in with mysterious symptoms, unexplained falls, sudden confusion, dangerous bleeding. And when we dig into their medication lists, I find the same pattern over and over. Supplements that were supposed to help are actually hurting. Vitamins that promised wellness are creating illness. And by the time they're in my ER, they've been taking these supplements for months or years, never connecting the dots between what they're swallowing every morning and why they feel progressively worse. Today, I'm going to tell you about 5 specific supplements that after age 60 often cause more harm than benefit. These aren't obscure products from sketchy websites. These are mainstream supplements your doctor might write down at your annual checkup. And I'm going to explain exactly why they're dangerous, what they're doing to your body, and how to have the conversation with your doctor to stop taking them safely. Because the supplement industry, even the medical grade part of it, is built on the idea that more is better. More calcium for your bones, more vitamin D for your immune system, more fish oil for your heart. But after 60, your body processes these differently. Your kidneys don't filter like they used to. Your liver doesn't metabolize the same way. And what helped you at 45 can hurt you at 65. And you need to know which supplements to quit. But before I tell you which supplements to stop, you need to understand something fundamental about how your body handles these nutrients after 60, because this is the part nobody explains clearly. Here's what changes after 60. Your kidney function declines by about 10% per decade after age 40. Your liver metabolizes drugs and supplements more slowly. Your stomach produces less acid, changing how you absorb nutrients. And your body's ability to regulate and excrete excess vitamins and minerals diminishes. This means supplements that were perfectly safe at 50 can accumulate to toxic levels at 70. But here's the trap. The symptoms of supplement toxicity look exactly like common aging problems: fatigue, confusion, weakness, nausea, dizziness. So what happens? You tell your doctor you're tired, they assume it's because you need more vitamins. They add another supplement. The problem gets worse. It's a vicious cycle, and I see it constantly in the ER. I've treated patients hospitalized with calcium deposits in their kidneys from too much calcium supplementation. I've seen vitamin D toxicity causing dangerous heart rhythms. I've watched patients bleed uncontrollably because nobody told them their fish oil was interacting with their blood thinner. The supplement that was supposed to prevent problems became the problem. And the worst part? It's completely preventable. So the question isn't, should we take supplements? The question is, are we taking supplements that our aging bodies can't handle, creating more damage than benefit? And after 60, the answer for certain supplements is yes, they're hurting you. Now, let me tell you which ones. Number 1. High-dose calcium supplements, over 1,000 milligrams daily. This is the one that shocks people most because we've been told for decades that calcium prevents osteoporosis and protects our bones. And that's partially true when you're younger. But here's what the recent research actually shows. Taking high-dose calcium supplements after 60, especially over 1,000 milligrams per day, doesn't strengthen your bones as much as you'd think, but it does significantly increase your risk of kidney stones, cardiovascular events, and dangerous calcium deposits. Why? Because at 60 plus, your body's ability to properly distribute calcium changes. Instead of going into your bones where you want it, excess calcium ends up in your blood vessels, contributing to arterial stiffening and plaque formation. Multiple large studies, including research published in the British Medical Journal, found that calcium supplementation increased heart attack risk by 20 to 30% in older adults. Let that sink in. The supplement meant to protect your bones is damaging your heart. Then there's kidney stones. I see patients in the ER doubled over in pain from kidney stones, and when I review their medications, they're taking 1,200 or 1,500 milligrams of calcium daily because their doctor said it would prevent fractures. But their kidneys can't process that much calcium anymore. It crystallizes, it forms stones. The pain is excruciating, and if stones block the urinary tract, it becomes a medical emergency. Here's what people don't realize. Most adults get 600 to 800 milligrams of calcium daily from food, dairy, leafy greens, fortified products. If you're adding another 1,000 to 1,500 milligrams in supplements, you're getting way more than your body needs or can handle. The National Osteoporosis Foundation now recommends total calcium intake, food plus supplements, should not exceed 1,200 milligrams daily for women over 50 and men over 70. And many experts suggest getting calcium primarily from food, not pills, because dietary calcium doesn't carry the same cardiovascular risks. But doctors still write "take calcium" on the discharge paperwork after a bone density scan, and patients assume more is better, so they take it faithfully. And months later, I'm treating them for the consequences. You want strong bones? Focus on vitamin K2, which helps direct calcium into bones and out of arteries. Focus on weight-bearing exercise. Focus on adequate protein. But high-dose calcium supplements after 60? They're causing more problems than they're solving. But calcium isn't the only supplement creating dangerous buildups. What I'm about to tell you about vitamin D might completely change your morning routine. Number 2. Megadose vitamin D over 4,000 IUs daily. Let's talk about vitamin D. It's been called the miracle vitamin. It's prescribed for everything: immune function, bone health, mood, cancer prevention. And vitamin D deficiency is common, especially in older adults. So doctors test your level, see it's low, and prescribe 5,000, even 10,000 IUs daily. Sounds responsible, sounds science-based. But here's what's happening. Vitamin D is fat-soluble. Unlike water-soluble vitamins that you pee out if you take too much, vitamin D accumulates in your fat tissue. And after months or years of high-dose supplementation, especially in people over 60 whose kidneys don't regulate it as well, it can reach toxic levels. Vitamin D toxicity, called hypervitaminosis D, causes a dangerous rise in blood calcium levels. The symptoms? Nausea, vomiting, weakness, confusion, kidney problems. And here's the cruel irony. The symptoms look like common aging issues, so nobody suspects the vitamin. I've had patients in the ER with altered mental status, family worried about dementia, and we find sky-high vitamin D levels from taking 10,000 IU daily for 2 years. We stop the supplement, the confusion clears. It wasn't dementia, it was vitamin D toxicity. But those months of being over-supplemented damaged their kidneys, and that damage is permanent. The Institute of Medicine sets the upper limit for vitamin D at 4,000 IU daily, and even that's considered high for long-term use. Most people need between 800 and 2,000 IU daily, but I see prescriptions for 5,000 or 10,000 routinely, especially after a blood test shows low levels. Here's the problem with those blood tests. The range for deficiency keeps changing. What was considered normal 20 years ago is now called deficient, leading to more people being treated. And there's no solid evidence that pushing vitamin D levels into the high normal range provides additional benefits. In fact, some studies suggest very high vitamin D levels might increase fall risk and fractures, the opposite of what we're trying to prevent. If you're taking vitamin D, and you probably should be, at a moderate dose, get your levels checked periodically. If you're in the normal range, you don't need megadoses. And if your doctor prescribed 5,000 or 10,000 IU daily, ask if that's still necessary or if you can reduce to a maintenance dose. Because I'm telling you, from the ER perspective, vitamin D toxicity is real. It's under-recognized and it's completely avoidable. But vitamin D isn't the only supplement that seemed harmless until it wasn't. The next one I'm going to tell you about is in almost everyone's medicine cabinet. Number 3, iron supplements without confirmed deficiency. This one frustrates me because I see it constantly. A patient over 60 mentions feeling tired. The doctor, without checking iron levels, says, try an iron supplement. Or a patient had low iron years ago, started a supplement, and just kept taking it forever without rechecking. And iron is building up, silently, dangerously. Here's what you need to know. After menopause for women and throughout older age for men, iron deficiency becomes less common. You're not losing blood monthly. You're not growing. Your iron needs decrease. But your body has no mechanism to excrete excess iron. None. If you take in more than you need, it accumulates in your organs, your liver, your heart, your pancreas. This condition is called iron overload or hemochromatosis when it's genetic, but you can create a similar problem by oversupplementing. And excess iron is toxic. It generates free radicals. It damages tissues. It increases your risk of heart disease, liver disease, diabetes, even certain cancers. I've treated patients with organ damage from years of unnecessary iron supplementation. Their ferritin levels, the blood test that measures stored iron, were off the charts. And when we stopped the iron, they felt better. Their fatigue improved because the iron wasn't helping their energy. It was causing inflammation and damage. Here's the thing. If you're truly iron deficient, supplementation is important. But you need to know you're deficient through a blood test, hemoglobin, ferritin, iron panel. And once your levels normalize, you stop. You don't take iron forever just in case. Yet I see patients taking 65 milligrams of elemental iron daily for years without ever rechecking their levels. And I see the consequences. Constipation, which is miserable for older adults. Nausea, which reduces appetite and leads to malnutrition. And systemic iron overload, which damages organs. The other issue? Iron interferes with absorption of other medications. It binds to thyroid medication, antibiotics, osteoporosis drugs, reducing their effectiveness. So you're taking medicine that isn't working because the iron you don't need is blocking it. If you're taking iron, ask yourself, do I have a current blood test confirming I'm deficient? If the answer is no, or if it's been more than 6 months since you checked, stop and get tested. Because iron supplementation without deficiency is not harmless, it's dangerous. But iron isn't the only supplement people take forever without questioning. What I'm about to tell you about fish oil might surprise you. Number 4. High-dose fish oil or omega-3 supplements. Fish oil, omega-3s. They've been marketed as heart-healthy, brain-boosting, inflammation-fighting miracle supplements. And there is some evidence that omega-3s from actual fish consumption benefit heart health. But here's where it gets messy. High-dose fish oil supplements, especially over 2 to 3 grams daily, can cause significant problems in people over 60, particularly if you're on other medications. The biggest issue? Bleeding. Omega-3s have a blood-thinning effect. They reduce platelet aggregation. In moderate amounts from food, this is fine. But in high-dose supplement form, especially if you're also taking aspirin, clopidogrel, or a prescription blood thinner like warfarin or one of the newer agents, you're at serious risk for dangerous bleeding. I've had patients in the ER with brain bleeds, gastrointestinal bleeding, bleeding that wouldn't stop after minor cuts, all taking fish oil on top of blood thinners. Nobody told them it was a problem. They thought fish oil was healthy. They didn't realize it was magnifying the effect of their prescription blood thinner to dangerous levels. And here's the frustrating part. When I ask, who told you to take fish oil, they often say, I just started taking it. I heard it was good for you. Or, my doctor mentioned it years ago. but nobody coordinated. Nobody checked if it was safe with their other medications. Beyond bleeding, there's another issue. Large, recent clinical trials, including the VITAL study and the STRENGTH trial, failed to show that omega-3 supplements prevent heart attacks or strokes in people without established heart disease. The benefit we thought was there, it's not showing up in the rigorous research. So you're taking a supplement that doesn't deliver the heart protection you expected, but it does increase your bleeding risk. That's not a good trade-off. If you eat fatty fish twice a week, salmon, mackerel, sardines, you're getting omega-3s the way nature intended. You don't need a supplement. And if you're on any blood-thinning medication, including aspirin, talk to your doctor before taking fish oil. Better yet, just skip it. Focus on eating real food. Because high-dose fish oil supplements are not the benign health booster they're marketed to be. But there's one more supplement that I see causing problems constantly, and this one is recommended so casually that most people don't think twice about it. Number 5. Multivitamins with high levels of multiple nutrients. Multivitamins seem harmless. One pill, all your nutrients, convenient. What could go wrong? A lot, actually, especially after 60. Here's the issue. Most multivitamins contain 100% or more of the recommended daily allowance for numerous vitamins and minerals. And if you're eating fortified foods, cereals, breads, drinks, plus the multivitamin, you're getting way more than you need. And your aging kidneys and liver can't process the excess efficiently. The result? You're oversupplementing multiple nutrients simultaneously. Too much vitamin A, which can cause liver damage and bone problems. Too much folic acid, which may mask vitamin B12 deficiency, a serious issue in older adults. Too much vitamin E, which increases bleeding risk. Too much zinc, which interferes with copper absorption and immune function. It's not one problem, it's multiple small toxicities building up simultaneously. And the symptoms are vague. Fatigue, nausea, headaches, weakness. You feel worse, so you think you need more vitamins, and you keep taking the multivitamin, making the problem worse. Large studies, including the Iowa Women's Health Study, found that multivitamin use in older women was associated with increased mortality risk, not decreased, increased. Let that sink in. The supplement meant to make you healthier was associated with dying sooner. Now, that doesn't prove causation, but it certainly doesn't support the idea that multivitamins are universally beneficial. Here's my take. If you eat a reasonably varied diet, you don't need a multivitamin. If you have a specific deficiency, confirmed by blood work, supplement that specific nutrient. But the shotgun approach of take everything just in case, it's not helping. It might be hurting. I've had patients in the ER with toxicity from oversupplementation, and when we go through their routine, they're taking a multivitamin plus separate calcium, plus vitamin D, plus fish oil, plus iron. They're oversupplementing 5 or 6 nutrients at once, and they feel terrible. We stop everything. We recheck levels. We restart only what they truly need at appropriate doses, and they feel better. It's that simple. Now, you know the 5 supplements to question after 60, but here's what you're probably wondering. Why does this keep happening? Why do doctors recommend supplements that can cause harm? Several reasons. First, doctors are trained that deficiencies are bad, so supplementation seems like an easy fix. Second, supplement companies market aggressively, even to physicians, with cherry-picked studies and glossy brochures. Third, patients expect it. When you go to the doctor feeling tired, you want a solution. A prescription for a vitamin feels proactive, feels like the doctor is helping. Saying you don't need anything feels dismissive, even when it's the right answer. Fourth, there's a cultural belief that supplements are natural and therefore harmless. They're not. They're biologically active substances that affect your body. And fifth, there's no good tracking system. When you end up in my ER with a problem caused by a supplement, it's rarely recognized and reported. The supplement doesn't get blamed. Your symptoms get attributed to aging or a new disease, so the pattern continues. So what do? How do you protect yourself from harmful supplements? First, get tested before supplementing. Don't assume you're deficient. Know you're deficient. Second, if you're taking a supplement, get rechecked periodically. What you needed last year, you might not need now. Third, tell your doctor and pharmacist everything you're taking. Don't assume supplements are too minor to mention. They interact with medications. They have side effects. They matter. Fourth, less is more. If you can get a nutrient from food, do that. Your body absorbs and regulates nutrients from food far better than from pills. And fifth, ask questions. If your doctor recommends a supplement, ask why. What deficiency are we treating? What's the goal? How long should I take it? What are the risks? Those questions will often reveal that the recommendation isn't as solid as you thought. I'm telling you this because I'm tired of treating preventable problems. I'm tired of seeing patients harmed by supplements they thought were helping. I'm tired of the assumption that more vitamins equal better health, because after 60, that's often the opposite of true. Medicine should be about helping you feel better, live better, function better, not about filling your medicine cabinet with pills you don't need that are slowly poisoning you. So if you're over 60 and taking calcium, vitamin D, iron, fish oil, or a multivitamin, pause. Ask yourself, do I know I need this? Has it been confirmed by testing? Am I taking the right dose? Is it interacting with my medications? And make an informed decision. Because supplementation after 60 is not automatically beneficial. It's complicated. It's individual. And sometimes the best supplement is no supplement at all. If this information helped you, if it made you think differently about what you're taking every morning, share this video with someone over 60 who needs to hear it. Leave a comment telling me which supplements surprised you most. And remember, informed patients make better decisions. You deserve to know the truth, not just the marketing. Thank you for watching, and I'll see you in the next one.